Dr. Cuezze, welcome. My name is Samantha Shepard. I am an attorney here at Shepard Elder Law, and I am thrilled that you took some time out to meet with us and answer a few questions we have about the vaccine. We're all living in fear, and I hope that you can do a little today to calm some of our fears. I understand that you are a physician and that you work for Elite Patient Care. Is that accurate?
That is true. Thank you for having me today.
You're welcome. So did Elite change its name recently? Is that what you shared?
Well, I'm the founder, and I'm with Kansas City Medicine Partners, and we're a group of physicians and nurse practitioners in the Kansas, Missouri, and now Illinois area that since 2004, we've been taking care of seniors in long-term care, assisted living, independent living, and clinic settings. In 2019, we were lucky enough to partner with a larger group that is similar to ours, named Elite Patient Care. And because we are expanding now to St. Louis and Illinois, we are going to rebrand as of January 1 under the Elite Patient Care name. So we'll still be all the same people in Kansas City Medicine Partners, but we're going to have a new name and logo.
But you get to be here in Kansas City, so we get you.
Yes, I'm based out of Kansas City. I'm the Chief Clinical Engagement Officer for the larger company. So I engage with patients, physicians, families, organizations across the country, but my home is here in Kansas City.
Thanks. So we get the skinny from you. So we have so many questions, all of us sitting around the water cooler, metaphorically, because now we don't have a water cooler, but all of us texting back and forth and talking to our friends are all worried. Is the vaccine actually coming? What will it look like? Should we be scared? So maybe I won't hit you with all those questions at once. So timeline, when do you think it's getting here?
Well, this is very, very exciting news. Over the weekend, we did receive the emergency use for authorization from the FDA for the Pfizer vaccine. It is an mRNA vaccine. And also on that timeline, we are looking at the FDA meeting this Thursday, December 17th, to begin looking at the Moderna mRNA vaccine. Both of those vaccines are very similar. We do expect emergency use authorization for the Moderna vaccine very soon as well. But the Pfizer vaccine started shipping over the weekend. You may have seen pictures of trucks and airplanes on the news, and that's very exciting. In fact, I just got a tweet that here locally, Truman Medical Center received their first supply and is going to start vaccinating their frontline healthcare workers. So it's all starting. It's a very, very exciting day, but we have a long ways to go.
Feels like we've been waiting for this for a very long time, when in reality it hasn't been very long. So can you do something to assuage some of our concerns that this has been a rush job?
Sure. Absolutely. Everyone kind of takes that term, the warp speed, and gets a little nervous. We've been looking at a vaccine. They normally take 5 to 10 years to make. How can we make one in a year? Well, it's a lot to do with a lot of really, really neat science. The actual mRNA vaccine platform we've been researching and utilizing since 2009, when we had the H1N1 pandemic. The NIH started putting money in mRNA vaccine research at that time, because they realized if we were to have a pandemic, we need to be able to make lots and lots of vaccines quickly. And the way we make, for example, the flu vaccine now is we grow it on eggs, and then we attenuate it, or make it so it's not a viable virus. Well, if we were to try and do that with the COVID vaccine, first of all, it would take years and years to grow that amount. And then it's very risky to actually grow live virus. With this mRNA platform, we can do it very quickly. We can ship lots of doses, and we can make them. And if there's a mutation, we can tweak the vaccine very quickly. If we need to do a booster in a year with a different mutation, we can do it very, very quickly. It can all be changed quickly.
Well, you brought something up there. If we need to do a booster in a year, do we know that yet?
We don't have any idea yet. The data is looking good for folks that were, early on in the vaccine trial, still having high levels of immunity. But of course, the folks that did vaccine trials, and I did a vaccine trial myself, so feel very excited about that and had a great experience. But folks like myself who have done vaccine trials will be monitored for the next 2 years to look at the level of immunity. And, we'll make decisions as we go. Of course, this is a novel coronavirus and all of the data and science are new, but I've been very impressed with the scientific community as far as getting a multiple good viable vaccines out there. And now we have approval for a safe and efficacious one. Hopefully we'll be getting another one soon.
When you say trucks and airplanes and the television, sometimes this country seems so much larger than that. So can you bring it down to a scale? Truman, one hospital. What about the others? Are we talking about this week, next week, months, or?
So what we're told is that Pfizer will deliver 6.4 million doses of the vaccine this first week. So that's a lot of logistics, a lot of, travel and cold chain storage and a lot of delivering. So, hopefully that will all go as planned, but I'm sure there'll be some, hiccups here and there, but that's how life is. But 6.4 million doses is what we're slated to get this week. And hopefully we'll be in the 10 to 20 million range by the end of the month if the Moderna vaccine is also given an emergency use authorization.
So then that's the whole country.
That's for the whole country, yeah.
And the hierarchy, can you speak to that a little bit?
Sure. So the hierarchy was developed by the CDC. And when we say hierarchy, we mean of like who's going to
who's getting it first?
Receive the vaccine first. And that was developed federally. Those decisions were made federally. But each state and jurisdiction has their own ability to tweak that and modify it. But generally, the consensus is that frontline healthcare workers and seniors that live in congregate living facilities should be the very top of the list. So as we see shipments going out this week, they'll be going to hospitals. And when I'm getting communication from the local hospitals, what I'm hearing is that they are going to stratify their doses and give them to the people that are most high risk. So working in the ICU, working on COVID units, of course, every person is at risk for COVID. Every healthcare worker is at increased risk for COVID, but those that are working, directly with COVID patients are probably what most of the hospitals are going to target first. And then as, week 2, maybe they'll be able to, give more healthcare workers. The process for seniors and congregate living facilities is a little bit different. Do you want me to go over that process a little?
Yeah, that would be fantastic. What's that going to look like?
It is different. So in October, every single skilled nursing facility and assisted living facility in the United States was asked to pick a pharmacy partner to be their COVID vaccinator, basically, to administer the COVID vaccine to them. And last report I got, there was almost 100% compliance with that. Every single nursing home, assisted living in this country identified their pharmacy partner. The most are being serviced by either CVS or Walgreens, although some other long-term care pharmacies are also being used in more rural areas, or if there's an area where CVS or Walgreens isn't available. And the good thing about this is these are companies that are used to doing mass vaccination. They're used to coming into skilled nursing facilities and doing their flu vaccine every year. So they're not doing anything that they aren't already used to doing. They already have the staff. They've been, working on the processes.
Can I interrupt you with a quick question then? That's very interesting. But when you say that they're used to doing the flu, it made me think, well, I don't know the numbers. How many vaccines are typically coming out for the flu across the country so we can compare?
Like how many versions of it?
No, sorry. Let's see if I can say it. 6.4 million are available now of the vaccine that we need for COVID. Comparatively, how many vaccines do we generate annually for the flu?
I don't know that exact number off the top of my head, but the in skilled nursing and assisted living, the compliance rate with flu vaccination is very high. It's above 90%. So there are very few people that we get that decline their flu vaccination. Some of the staff do, but it's among the actual population of seniors, the compliance rate is very, very high for annual flu vaccination.
Well, that's another question then. If you are a staff person, and certainly if you worked with, well, I'll try not to be judgmental. I would say, are these facilities allowing some of their team members to not have the vaccine?
So at this point, with the vaccine having only emergency use authorization, they are not requiring their team members to do COVID vaccination. As we look into late spring, perhaps summer 2021, and there is a full approval for the vaccine, then I think individual employers will decide whether or not at that time to make COVID vaccination mandatory. But under emergency use authorization, employers are not making it mandatory.
All right. So when do you think, let's say, technically, wait a minute, lawyers are considered essential. Isn't that a silly?
For sure, yeah.
I don't necessarily agree with that, frankly, but I'm sure there's some sort of lawyer that's part of the lobby there. But when will it be available to normal people at a CVS or a Walgreens, in your opinion?
I think we're probably looking at late spring to early summer. When we say normal people, that's going to be age 16 and up. There are currently trials of these two vaccines undergoing for that 12 years old and up population. But the young children, we're yet to see these two vaccines have started trials. So for the general population, age 16 and up, hopefully we're looking at April, May, somewhere in there where it will be generally available. You can walk into like a CVS or Walgreens and get the vaccine. It is the logistics and cold storage of these vaccines are a little bit more complex than a typical flu vaccine or other vaccine you might get at your doctor's office. So I don't think that it will be quite as widely available at individual physicians' offices and departments of health than, say a flu vaccination. But again, it should be pretty widely available at the pharmacy partners.
And why did we pick not to test with the children?
I think that it was just low hanging fruit. We really, really needed to get a vaccine out for the most amount of people in the quickest manner. So there wasn't a lot of resources to do that. We have to, put our eggs in the basket that's going to make the most impact. And early on, it was recorded that children had a better outcome if they were infected with the virus. So I think we have to target where we can make the most impact.
So if I were a senior in an assisted living right now, I would be as likely or not quite as likely as somebody in a full skilled nursing to have access to the virus. We think we're going to the top tier of care?
I think we'll be hitting the top tier first. The actual pharmacy partners are going to make those decisions about where they're going to go based upon the availability of the vaccine and how much quantity they have. But so each skilled nursing facility, assisted living facility should be working with their pharmacy partner, and the pharmacy partners are going to be setting 3 dates for them for hosting COVID vaccine clinics. And the pharmacy partners will let the individual skilled nursing facility, assisted living facilities know, what they need. They need a room with this much space. They need, access to the patients. They need consent forms to be done ahead of time, that sort of thing. So the pharmacy partners are working directly with the facilities to get that all set up as we speak.
This is amazing news. It's almost surreal. We've been through such a long, stressful period, depression, anxiety, unknown, and fear. So this is good news. There are always those who are going to be fearful, but your message to me seems that you're saying celebrate.
My message definitely is that this is a very exciting day for the United States and for the whole world. But definitely go ahead and celebrate, but do not let up your guard right now. Even if you do get vaccinated, we recommend continuing to wear masks, continuing social distancing efforts based upon your local guidelines, because we don't know for sure that people that have been vaccinated can't go ahead and transmit viral particles if they are exposed. Those studies are undergoing right now. We should have data on that in the next 2 to 3 months. And certainly there are lots of members of our society that can't get vaccinated yet because of supply or other medical reasons. And we definitely want to protect those people as well. So yes, this is a great day, and it's certainly a very faint light at the end of a long, long, long and dark tunnel. But do not let up any of your restrictions as of yet.
Okay, well, I am very grateful to you for sharing your time and your message. And I'm walking away with a feeling of positivity and hope. And hopefully it will be a new chapter. It's certainly a new chapter. It's already a new chapter.
For sure.
It's with a little bit of light, and then the light will expand. That part that you said there about we're not sure whether let's say the frontline healthcare givers are the ones that we want also to have access to the vaccine. But and you said in there that we aren't sure, it's possible, but we aren't sure that then they cannot transmit, even though they cannot get the virus. They still may be, I don't know what the right terminology would be, they can pass it along even if they don't get it.
Yeah, transmit. Mm-hmm.
Okay.
Yeah, so again, we are doing studies to first make sure the vaccine is safe and effective and get it out to people as soon as we can. And we're at that point, but there still are a lot of unknowns. And one of those, like we talked about earlier, is how long does the immunity last? There's going to be a lot of following people for years to determine that. The other one is, how well does it work in children 12 and up? Those studies are ongoing. And then, a good question is, if I'm fully vaccinated and I've had my second dose and it's been a week or two after my second dose, does that protect me from shedding viral particles that could be spread to people who are not vaccinated? And we don't know the answer to that yet. So those studies are currently ongoing. And again, Pfizer says they should have some data on that in the next 2 to 3 months. So we're hopeful that's the case.
Can I translate that down a little bit? Translating down shedding viral particles, you mean coughing germs on people?
Well, yeah, if you were to cough, sneeze, are there any active viral infectious particles that could transmit the disease to someone who's not vaccinated? So we hope that that's the case, that vaccinated people are fully protected, but we don't know for sure yet.
All right. Again, I can't thank you enough for taking the time, Dr. Cuezze. Thank you so much. We appreciate your expertise and your time and for sharing with us a little bit of hope.
Well, thank you for having me.
You're super welcome. Oh, I'm not supposed to say super.